Retired nurse Geraldine Milady was unsteady on her feet and suffered a number of falls. She was diagnosed with acoustic neuroma, a non-cancerous tumour growing on the nerve from her inner ear to her brain.
The symptoms I first experienced was a loss of balance. And first of all, it was so fleeting, I actually thought I was imagining it. And then over the years, it's just got worse. Approximately, it was 16 times a day that I was losing my balance. The local doctor sent me for a CT scan, which didn't identify the neuroma. So then I was sent for an MRI and it was diagnosed on the MRI.
There were not many treatment options for Geraldine.
I was terrified of having to have surgery, and I've seen photos of people that have had surgery and the way it has affected their presentation. You know, they look like they've had strokes, some people.
But her fears were allayed after a meeting with Dr Claire Phillips at Peter Mac Cancer Hospital in Melbourne.
So everybody always says what the Gamma knife isn't, is it's not a knife. It's a radiation treatment machine, and it's specially designed to treat really quite small targets in the brain. They can be cancers or they can be other problems that are causing pain or seizure disorders or something like that in the patient's head.
Tiny beams of radiation are delivered with millimetre accuracy at either one or many tumours at the same time, leaving the healthy brain tissue untouched.
The way that it's designed, obviously, is so that we can target that radiation at the problem that we want to treat.
The Gamma knife treatment works exceptionally well for patients with brain cancer, benign tumours, or patients with functional disorders like seizures.
For the patients who have benign brain tumours, so these are lumps that grow particularly in the base of the skull where it's hard for a surgeon to access, radiation offers an equivalent probability of controlling the tumour, but again with very few side effects. So they don't have to undergo an operation where their brain is open, they don't have to stop driving, they don't have the risks of surgery. And then for patients with functional disorders, so maybe pain or seizure disorders, these conditions can be quite difficult to control. And often people who come for radiosurgery have, say, been on many painkillers for a long time. They've already had a surgical procedure for the pain, which maybe worked for a while but has stopped working, and so they have another option.
The Gamma knife treats more tumours and it's fast. A patient can be out of hospital and home within a day.
When I was under the Gamma knife machine, they play whatever music you like. There's no noise. It's very relaxing, and if you close your eyes, you don't even know where you are. It's less invasive than surgery. The recovery time is much quicker, and you can get back to your normal activities within days.
The message that we'd quite like to have is very much it's a public free service for Victorians, and I still get people asking me how much is it going to cost, and it would be nice for people to know that they don't have to be wealthy to come to this beautiful building to have this treatment. That's a pretty special thing, I think, that we can offer people.
Already it's made a huge difference in my life. I just feel more confident too that I can go out and walk. It does feel like a miracle to me.